Hello, thank you very much. And my name is Franklin Mustafa, and I want to take you through the likely Viva VOCE questions and how to tackle them. Uh, yes, let's look at the composition of the examiners. As you were examined in practical examination, they are most likely to be the same examiners who are going to examine you in the Viva VOCE. It's going to be one clinician and one tutor. One clinician, one tutor. Obviously, there will going to be an vigilator who will be ushering you in for you to go and defend your case study. So, one will ask why viva voce or a defense. This is because you said you have written on a particular condition. So, come and defend. So, viva voce is coming from a word which means oral examination. So, they are going to examine you orally based on what you have written as a case study. So you should be able to defend that you actually did the work yourself. So that's why you need to defend your case study. So most questions mostly depend on the examiner. But what I'm trying to take you through is the likelihood of these questions being asked. So you can prepare yourself for the oral examination or the viva voce. So the examiner will ask, can you tell me about yourself? These questions are being asked to relax the patient, what do call it, the candidate, to relax you. So about yourself, you know yourself, so you'll be able to. But most of it are not. Students even go talking about what they are not supposed to talk about themselves. So it's just because it's just a brief summary that you need to give yourself. So mostly what they need is your name, your age, where you're from, your parents, probably your siblings, but it should be brief. And when you're talking about your school, it should only be the SHS and the nursing training school you are attending. And then you can just tell them that you are working on something, you're working on diabetes, you're working on hypertension for your case study. Then that is about yourself. This is just to relax you so that you'll be able to answer the questions. So they can ask you, can you tell me about your patient or your client? Or someone asks, who is Mr. AA, Mr. AB? That's why they are referring to your client or the patient you work on. So you need to know much. So as a student, you need to be able to tell the name of the client. That is, if it is confidentiality that you don't need to mention the patient name, you can use the abbreviation, Mr. AB, Mr. AZ, or what. The age of the patient, the current place of abode where the patient or the client is staying. You should be able to also mention it. The occupation, the socio-economic lifestyle of your patient or your client should also, that is the kind of work the person does. You should also be able to tell them whether the person is married, the number of children, the religion, the level of education, the hobbies and lifestyle. I want to talk about lifestyle. Mostly when students are asked about lifestyle of the patient, they just give the normal routine the client does. Or he baths at this, he wakes up at this, he offers prayers. But when we talk of lifestyles, we talk about what the patient does mostly, even though what he does. But the lifestyle includes smoking, drinking, attire. So what does it do? So you're trying to link the disease condition to the patient's lifestyle so that you can educate the patient on the lifestyle changes. So mostly you should take note of that. And you should be able to tell the condition you're working on. So examiner may also want to ask, why did you choose your client? So you choose because you are working on hypertension, you're working on diabetes, you're working on sickle cell. So why? And in this case, you should be smart and state exactly what you wrote in your case study. Don't deviate. Some will write something else in their case study, and when you ask them why they choose that, they want to give you a different answer. That is not what the examiner read in your case study. So you should be able to actually say exactly what you wrote in your case study. If you finish with that one and you want to add some more, so some will say that, oh, I chose hypertension because my father or my mother is hypertensive, so I want to have more knowledge on that, on disease condition, so that I'll be able to take care of him. Or there are a lot of sickle cell patients I know, so I'm writing on sickle cell in order to educate them. Also to gain more knowledge. So don't deviate. Just go straight to what you wrote. So examiner was asked, can you tell me about your patient's condition? Here, the question is all about your case study. Just briefly about your case study. So here is a be smart and you must work within time because you are timed. Sometimes 10 minutes, 5 minutes, 15 minutes, depending on the examiners. So the condition you're working on, so okay, I'm working on diabetes. Brief definition of diabetes, followed by the pathophysiology. Briefly, not extended. Then the causes, the signs and symptoms, the management, prevention, and if there are public health important to the disease condition, you state it. So when we talk about that, exactly what you should be able to. But now, so examiner may also want to ask, summarize your work to me. It's almost like the first one. Tell me about your condition or your patient. So you summarize it. So in a nutshell, you describe your case study. So the title of your client, where you met him or her. So I met Mr. AB at the hospital, or in the, this one is about the, if it's a, you are doing general nursing, it's a hospital. But if you are doing public health nursing, it's about in the house. So you can meet the person in the hospital, but when he's discharged, that's when you start your case study as a public health nurse. But for the general nursing, they do their case study in the hospital. So the difference should be there. So about the condition, briefly, and the public health importance, why you chose the condition or the client, when you started it, the number of visits you did, the problems you identified, how you manage the problems you encountered. So briefly, you can do that. When you ended the visits, the improvement that came about. So I met my client and the HB was 7.9, but by the time I handed him over, his HB was 12.5. So let's talk about the case of a pregnant woman. So how did you end it? But he was filled in, but by the time you finish all your interventions, he was able to walk. So these are the improvements that you have to state. The blood pressure was shooting, but by the time I handed him over or her over, he has a normal blood pressure. These are the things that we need to hear, the improvement that you were able to achieve. Some examiners can ask, how many books did you reference? You may think it's not significant, but you can ask me, how many of them? Don't underrate anything in your case study. Don't underrate. Don't underrate at all. Be able to know the books you used as reference. You can be asked to state at least 2 of them. And when you come to the specifics, these are general ones that any of the examiners, either the clinician or the tutor, will ask. But mostly, when it comes to specifics, examiners tend to ask questions based on their expertise. So a typical bedside nurse will be asking you about admission, discharge, drug administration procedures. You understand? But some of them are also into pathophysiology, medicine, and other things, so they can ask you. But a tutor who is teaching you medical nursing, a tutor who is a medical nursing tutor, the examiner, sorry, who is a medical nursing tutor, who want to ask much about the chapter 2, that's the literature review, including pathophysiology. What medical intervention, what drugs did you use? So these are, what are the effects of the drugs? So these are things that you should be able to know. So let's a tutor who is teaching pharmacology and he's sitting in front of you. Definitely, you want to know your knowledge on drugs. So, what drugs was the patient put on? What's the mechanism of action? What are some of the side effects? To ask you. The tutor who is sitting before you and is a tutor of anatomy and physiology. We want to ask you more questions about the affected structures. We talk about pneumonia. So, can you describe the lungs? What are the so he will ask you questions in anatomy and physiology. A tutor who is teaching you basic nursing will ask you questions based on the basic nursing because that's what he does. And the tutor who is teaching you public health nursing will also want to ask questions based on public health nursing. Nutrition, so what diet was the patient put on? So nutrition tutor will ask you questions on nutrition. And the examiner will ask, what did you do on your third home visit? So RGN, that is the last visit. But for the public health nursing, you have about 8 home visits to do. So what did you do? What problems did you encounter? And how did you solve it? It is in the book and you refer to it. So be able to be familiarize yourself with it. So be cognizant of how many visits you made and what you did on each visit. This is not usually asked, but some examiners will ask you. So again, be abreast with the current health issues. So in conclusion,